All right, so we have Dr. Annabelle here with us. A quick introduction. Dr. Annabelle, she is a clinical psychologist in Singapore, and she works with people who suffer from personality disorders, and she also treats individuals who are suffering from complex trauma, anxiety and mood issues, and relationship difficulties. So this is the first part of Dr. Annabelle's talk. So today she'll be presenting on how we can manage temper tantrums in our children. Right, take it away, Dr. Annabelle.
Thanks, Celine. Hi, everyone. I'm Annabelle. Thanks for joining me today on such a rainy Saturday afternoon. We'll be talking a little bit more about managing temper tantrums in our children. All right. Okay, let's go. All right. What are temper tantrums and why do children throw them? Well, in my opinion, I think tantrums are really like an explosive, disorganized display of anger and frustration. And often I can imagine you would have experiences with your children where they might be lying on the floor, they might have their arms swinging all over the place, they might be punching, kicking, pinching, screaming, crying, and usually they are accompanied by an exasperated parent, as you can see myself there. A lot of times, I think it is myself as a parent where I find it very difficult to contain how I feel about my child's tantrums, particularly if they are happening in public. I do actually remember there was one day I was bringing my child for a walk before dinner, and he insisted that I must carry him. And because I didn't, he had this massive meltdown and he started screaming and shouting. And as he was doing that, our neighbors in the neighborhood was actually shouting out the window and saying like, control your child, you know, your child is really loud, he's crying, what's wrong with you? I did feel like the worst parent in the world at that moment. But when I went back and reflect on what I did, I think I still stand by the way that I managed. So today I'm going to share with everyone how I managed that situation. So firstly, that's the tantrums that we are aware of, right? That we are very familiar with, the screaming, the shouting, you know, us getting very annoyed, very irritated, very stressed about it. But actually, I would like to invite you to rethink the concept of tantrums. And in fact, developmentally for a child, it is actually really healthy for them to express themselves in a way that they know how. And at that age, the way they know how is by screaming, shouting, and, you know, fighting, because all of us go into a fight, flight, or freeze mode when we are faced with danger or when we are stressed or when we are anxious. So fighting would really be the screaming, shouting, punching, kicking, right? Flighting will be the running away. And then freezing will be the uncontrollable crying that the child presents with. So before the child is actually taught how to manage the big feelings that they are feeling, they will only know how to react in very primitive ways. And when they are expressing themselves through tantrums, it is actually a very healthy external expression of the emotions. If your child is not, doesn't have any tantrums and does not express their feelings at all, I would actually be more worried about that. So if you think about like our house under construction, a lot of times, the way that we grow up, think of it akin to us constructing a house. So like how you build any house, you need to screed the cement, you know, you need to lay the tiles, lay the parquet, you need to build from the bottom up, and then you start to put up the walls, you start to put the roof, and you start to put all the electrical wiring and the things inside. Just like for children, you know, the brain doesn't actually develop fast enough, you know, and that's why when they are little kids, they can only respond in very primitive, automatic ways. So as they grow older, the brain starts to actually kind of develop higher order functions. So the ability to then recognize their emotions, express their frustration in other ways, tend to be there, because as you build the house, you know, when you put tiles, when you put walls, then you actually have more resources and your house is more together, right? Then you can start hosting people in that sense. So when the child's brain start to grow as they mature, they're better able to manage their feelings and they're better able to learn and manage their stress. Of course, in the early days, that means that they require some bit of guidance from us. This house will only be completed in adulthood. Anyone want to make a guess as to like what age our brain fully develops? And as you type in some guesses, I'm going to figure out how I open up the chat. Okay, got it. Yeah. Anyone want to make any guesses about like how old you are before your brain is fully developed? 5. Thank you, Hazel. Anyone else? 30? 25, 25, 18. Wow, okay. Thank you guys and thanks for participating. Thanks for making me feel like you're with me as well. Yes, you're actually absolutely right. It's about 25 years old that our brain fully develops. So actually before 25, if you think about it, even in adolescence, they tend to be very impulsive because they don't actually have sufficient brain function to weigh the pros and cons before they make a decision. I always also tell my patients, then you better try not to get married before 25, right? Because you want to have like a full brain functioning so you can weigh your pros and cons and think about it holistically before you sign those papers. But just similarly, emotionally, only when your brain fully developed, then you have the full cognitive function to process your emotions and make sense of it. Having said that, right, I think it's not unfair to say that even adults, as we struggle to manage our own emotions sometimes. And if we cannot really manage our emotions because we haven't really been taught the way how, then of course our children will not know how to manage this. So we're going to go through some ways on how we can help to manage your children's tantrum. But first, press pause. I want to remind all of us parents a few things. When your child is throwing a tantrum, it does not make you a bad parent. So, you know, when my neighbor was screaming out of his window, like, you're a bad parent, you're a bad mother, you can't even control your child. Oh my God, I had actually I absorbed the full extent of that criticism. But hang on, that does not make me a bad parent. It just meant that my child was having a hard time and I would rather be there with him to support him than to actually scream at him and criticize him and not give him resources to deal with the tantrum. The second thing is, sometimes I subscribe to the thought that, hey, you know, maybe my child is just trying to make my life harder. It's not as if like he doesn't know I'm a full-time working mom, I'm really tired, and I come back and he has this full-on meltdown and I have to deal with this. But it's a reminder that actually our child is not actually trying to make our life harder. They have unmet needs that they cannot otherwise express themselves effectively, or they may not have the words to communicate with you. So in the situation of my child having a temper tantrum when I have been absent the whole day from home, it is actually because my child misses me and he wants to spend time with me, but he doesn't necessarily have the awareness or the ability to communicate that with me. Then he might just go into a full-on meltdown of like screaming and shouting. We cannot control and we cannot stop the tantrums. In fact, nothing, and I'm sure you would have tried this, as have I, nothing that you actually really say is going to stop the tantrums. If you don't stop now, I'm going to hit you. Or if you don't stop now, I'm going to walk away. If you don't stop now, I'm going to take away your lolly, you know. It just persists, you know, the tantrum just become bigger. They do not stop. And all we can do is actually to share our calm. So it's actually, you know, when our children are distressed, all they actually really need at that point is to absorb the calm that we have. And if we can share the calm with them, it would help them calm down faster, even though you cannot like stop the tantrum immediately. Also, I found it really helpful to kind of focus on what I can and cannot control. So I cannot control the fact that my child is going to continue screaming, shouting, and, flapping his arms. But I can control how I react towards him, whether I'm raising my voice at him, whether I'm calm and supportive and speaking in a calm tone, whether I'm loving, whether I give him physical support through hugs, through touch. So that is something within my control. So I would say very much like manage our own expectations. You will also want to kind of think about reframing, like changing the way you think. So when I think that my child is just trying to be funny or just trying to make my life difficult, I actually find myself getting a bit more defensive and finding myself getting a bit more angry because I feel like, oh my gosh, my life is already very tiring already and you're doing this on purpose. But my child does not actually have the cognitive functions at that age to manipulate me that way because the house is still under construction and he doesn't have his electrical wirings in place yet. He doesn't have his furniture in place. He probably only has his screening and his flooring almost halfway done. So because of that, he doesn't actually have the cognitive function to manipulate me into kind of making my life harder so that he can get what he wants. We need to try to press the pause button to manage our emotions. And a lot of times I really think it's about managing my own emotions before I can help to manage my child's emotion. And what I have learned through my own parenting journey is that a dysregulated me cannot regulate a dysregulated child. And I'll share this story. Just actually a couple of nights ago, I was going to put my children to sleep. And for the many days of the week, my children have been asking for me, but I have been stuck at work. So my husband has been putting them to sleep and they have been melting down asking for me. But in the same vein, when I was putting them to sleep, they were melting down and asking for daddy. And then prior to that, I already had a very long day. I was tired. I went home. I told myself, practice patience, Annabelle, get through the eating, which I imagine in many households is also a similar war happening at dinner time. Get through the shower, get through the routine. I'll just put you to sleep and I have a little bit of alone time. Practice patience, practice patience. And when he wouldn't sleep and he started this massive meltdown, oh my God, I could feel myself boiling and I could feel myself like starting to breathe heavily and I could feel like I needed to shout and tell him to stop it. And that's where I noticed that I was dysregulated. So I think we can try these few things internally. I will tell myself, stop, because I know I'm going to regret that later. So stop means like, if I feel like I'm going to shout, or if I feel like I may lay a finger on my child, or I may say something unhelpful, which I will regret later, stop. If you have your partner or another family member at home, you may want to tap out and say, you know what, mommy needs to take some time to breathe. I'm going to come back to you later. Give me 5 minutes. Mommy needs to get a sip of water. I'm going to come back in 2 minutes. Mommy needs to take a shower first. I will come back in 10 minutes. But tap out, but you need to verbalize that with to your child, because if you don't, they might feel abandoned and they will be very anxious and very scared. So stop whatever that you would otherwise be doing and just have a bit of a shift in that mindset. Your child is not actually trying to make your life difficult. Your child is overwhelmed. He or she has unmet needs that he doesn't know and hasn't learned how to express to you. Because when you say that to yourself, and that is actually in reality the truth, I don't know whether if you say that to yourself now, do you notice a little bit more empathy growing inside you? And we could use a little bit of that empathy for yourself and your child. Acknowledge your own emotions. Actually, if you are going to shout at him, is it more an expression of your frustration, or is that actually helpful for him? And is that actually an effective way to get him to learn a lesson? If the answer is really just an expression of my frustration, then I will really need to rethink how I can express my frustration in another way that would not make the current situation worse. engage in value-driven parenting, and I see this as an opportunity. Something that my husband often jokes with me is that as a psychologist, he often says to me, I think that your empathy and your patience levels expires the time you knock off. And then when you come back, right, you have no more patience. And then sometimes I realize, oh my gosh, he's right, because I've used up all my patience. But that also made me more mindful of how patience is actually an important value to me, and kindness is an important value to me. If my child is having a tantrum and I respond in an unkind way and an impatient way, actually, I'm not living a life consistent with what is important to me. So while each tantrum is difficult, I see it now as an opportunity to become a better parent and a better person. And in that light, I then thank my children for actually making me a better person. And a lot of times that's kind of also that parenting that I really subscribe to. I think that through, I think parenthood is really, really hard. And I hope that you all can take a moment to give yourself a pat, on your shoulder. And the fact that a Saturday afternoon, you're spending time with me trying to figure out like how to manage tantrums, that makes you a good enough parent. That makes you a parent who actually wants to be a better parent for your child. So start to think a little bit about what other values are actually important to you when it comes to parenting, and what other values are important that you want your child to have as they grow into an adult. We are all not saints. We have long days. We have other competing stresses and responsibilities. And that means you will lose it sometimes. And, if one of you who is, in the webinar with me have not lost it, I would have to take some notes from you, and I have a lot of respect from you for you. But I have lost it many times with my children. I'm not proud of it. But I think that's real parenting, right? There are going to be days that you are not going to be the best version of yourself, and you're not going to be that best parent, but which is also not what I would encourage aiming for. So we just aim to be good enough, right? And when that happens, I think what is more powerful and more important is really to apologize and to own up. So I do find myself saying that to my children, I'm sorry for shouting at you. Mommy was angry, but that doesn't give me the right to shout at you, right? Mommy should have walked away. I should have gone to drink some water, take a shower, breathe, and then come back and talk to you. It doesn't make that right. And I think there's a lot to learn from that, right? Because one, it helps to build the connection and the relationship between you and your child. And often my child would say, it's okay, mommy, it's okay, I know. And then I feel terrible because I feel so guilty, like my child's so forgiving. And there I am, just lost it at him when he himself is actually struggling to make sense of what's happening for him. And that's why the tantrum happened. But I'm also proud of him that he is being forgiving, which is an important value, right? And we also teach them that it's important to take ownership for the mistakes that we have made. So if he made a mistake, then he will know to take ownership for it as well. So that's what I try to do internally. Externally, what are some things that we can say? So I've tried these things and I like them. And I'm still constantly practicing them, and I'll share it with everyone. So I always believe in connection before correction. And even if I think about it in an adult setting, right? I think about the conflicts that me and my husband has. And when I'm very emotional and when I'm crying or when I'm sulking, whatever logic that he tells me is just white noise and rubbish. If anything, it just annoys me even more and it just upsets me even more. And that's not different from our children, right? When we are emotionally dysregulated, when we are under the pump, we are upset. We cannot actually listen to logic. We need to pick the right timing. So if we ourselves cannot listen to logic when we are upset, how can we expect our children to listen to logic when they're upset? If we ourselves cannot stop it, like if your husband says, just stop throwing a tantrum, stop sulking, just move on, what's the big deal? And I don't know about you, but I can't, like if I'm upset, I'm not just going to be able to snap out of it. Then me telling my child to stop it, like stop your tantrum, is almost like moot point. So some things that I have found to be helpful would be, one, I want to connect with them. I want to focus on their emotions because I want to help them identify how they're feeling at the moment. So I might say something like, I can see you are very upset now. I can see that you're very angry now. I can see that you're frustrated now. I can see that you are XXX, the emotion now. So you're helping them label and make that connection between that emotion that they're feeling and what is happening for them at the moment. Then I would want to describe the situation. You want to play more at the playground. So I think, when I speak with my patients, the playground is a common struggle that all parents have. Your children playing, and it happens in the clinic as well, right? Like we have play dates at the clinic, or, sometimes the patients come in and, we have a rock climbing wall here and we've got the gyms. The children play and they do not want to go home. And parents get exasperated because we have to make dinner times, we have to rush off to something else, but our child has no concept of time. And your child does not want to leave. So I would describe the situation. You want to play more at the playground. You wish we don't have to leave now. And then I will empathize, right? It's hard to leave the playground when your friends are still there. You wish that you could still stay. I can see that you're having a lot of fun and you wish that you could stay longer. So empathizing helps us connect with that person. Just a bit like, in an adult fight, right? If your husband say, just do this, just do that, and you'll be like, oh my gosh, I can do it. Like, I don't need you to think for me. I don't know about all the other wives out there, or it could happen the other way around as well. But if your husband says, I can see that this is really upsetting you, I can see why like you'll be so upset about what your boss said, and I think it's, a terrible thing that your colleague said this about you, I wish your colleague didn't say that. More often than not, you will likely feel more connected and you will feel like this person is listening. You are not going to snap out of that sulking and that sadness at the moment very quickly, but you are moving in that direction, in that direction a little bit faster. Depending on the age of your children, I will offer age-appropriate choices, one, within very consistent boundaries. So there are different types of parenting, right? And the permissive type is, okay, you're crying now, you're throwing a tantrum, so I will just let you stay at the playground until you are ready to get home. So that's pretty permissive. Or like the very authoritarian way is like my way or the highway. We're going now because I'm your mother. I say so. You follow me now, or you just sleep at the playground. And that destroys connection. So I might say something like, hey, we agreed to 20 minutes of playground time. It's time to go now. So that's the part where you're asserting the boundary. We had an agreement. It's time to go now. And would you like to eat or shower first? So you're giving the child an option. You're giving them choices to make. Do you want to eat or do you want to shower first? Or do you want mom to put you to sleep tonight, or do you want dad to put you to sleep tonight? So you offer them options so they also feel like they have a part to say in the decision-making process. The thing with the playground challenge that I have found an interesting way to avoid the temper tantrums altogether is I use a timer approach. So I will actually prep ahead. And as we are walking towards the playground or heading towards the playground, I would have a conversation with my child and say, hey, I know it's, it may be hard to leave the playground later, when it's time to go, because your friends are there, it's fun. But you know what, we have dinner and I would like to read 5 books to you tonight and I really want to spend some time with you. How can we make it easier for you to leave? So children love it when they have a say. Just like adults, we love it when we have, like a part of us in the decision-making process. So now my child will say, okay, we can set timer. We can set 17 minutes. So like, okay, so we'll do 17 minutes and then you will press the timer and when it rings, we're going to go. Of course, the 17 minutes will start from the time that I will determine is the 17 minutes. So I won't wait until the time that I'm going to leave, then I start the timer. So that's something that I had to be smart about. But prepping ahead helps us to take one step away from having a meltdown as well. When they are having a meltdown, stay with them. Don't walk away from them. And if they allow you to, hold them, hug them, or, just be there with them. Just in the same vein with adults, right? If we have a fight with, our spouse, yeah, I know that sometimes I may not necessarily want him to really actually hug me, but knowing that if he's just sitting there makes me feel better versus okay, I'm going to walk away and I'm not going to talk to you. And then you just have your own meltdown and you just, do whatever you want and then we'll talk later. So this also comes to a very interesting concept that I wanted to talk about, which is like time in and time out. I think traditionally, we learn a lot about time out. So basically, parents removing children from the situation, and then they might put them in a timeout corner and then leave them alone to reflect. I think the updated research, I'm confident, I'm sure that the updated research is suggesting for us to adopt time in instead of time out. And time in is you still removing your child from the situation. So with the playground example, still removing your child from the playground, but instead of like putting them in a quiet, reflective corner and then you walk away, you actually sit with them through the meltdown and through the tantrums. So it really is your child, screaming, crying, telling you, I want to go back to the playground. I want to go back to the playground. And you're just sitting there. And then you ask them, would you like me to hold you? Would you like me to hug you? If they say yes, hug them. And you just let them and let them express themselves, but let them know that I am here with you. I'm not going anywhere. I know it is hard for you, but mommy is here. Okay. So again, you cannot stop the tantrum. It's not going to go away like that. But if you do that, it can help to reduce the intensity and the duration of the tantrum. Of course, there were moments where I have lost it as well. And then I have also learned painfully that when I have lost it, the tantrum becomes longer and more painful for both of us. And in the long term, it is not great for our relationship. So time in is exactly the what we've been saying, where you need to connect before you correct. So always think about connecting, emotionally validating before you correct. And I will only correct when the child is calm and when, the moment is over. After the temper tantrum, you go take a shower, you have something to eat. After that, then we can, shall we talk about what happened earlier? And then that is where you can do the correction. Okay, so I like to be prepared because, as I shared earlier, I've had neighbors scream out the window at me. I'm like, you're a terrible mom, stop your child, your child is out of control. So now I have learned the painful way of preparing ahead. So some things that I have found helpful was that I try to model healthy coping as much as I can. And the fact of the matter is actually children, they are very sensitive and they are able to pick up your emotions and, they are able to kind of like, how, think of a time when you're a little girl or a little boy and you want to buy cake, for example, or you want to buy a toy, for example, and then you will kind of start to look at your parents' face and mood before you go and ask for it. That's really what I'm trying to say. Like, children are able to pick up your emotions. So actually, when you're stressed, you're frustrated, you're anxious, you're angry, they can actually pick that up. And then they will cope by either fighting, flighting, or freezing, right? Because that is the very primitive way that they know how to. So, in such times, like example, if I use anger as an example, I would acknowledge that mommy is feeling angry now. And the language that I use with my little kids are, I'm in the red zone now. I will tell you a little bit more about the traffic light in the next few slides, but I will say mommy is in the red zone now. I will need to tap out. I need some time to myself. I'm going to take a shower and I'll be back in 10 minutes. In the meantime, would you like to play with this puzzle or would you like to do coloring? But I will be back. I will always emphasize that I will be back because children get very anxious naturally, primitively, when you walk away from them because there's separation anxiety. And when you walk away from them, primitively, it means that they are in danger. So if they melt down when you walk away, it's an appropriate response. But by telling them that you will come back, helps them cope better. Sometimes it also helps because children, depending on what age, may not have a concept of time. Put a timer, let them know when the timer beeps, you will be back. So I will narrate how I cope with anger. I will narrate how I cope with sadness. So my children have actually seen me cry before when I was incredibly upset about something, and they will give me water and they will give me tissue, and I'm like, you guys, you're a psychologist child. And it was a very proud moment for me. And then my child would ask me, Mommy, why are you crying? Then I would actually use that as a teaching moment to say, Mommy is very sad. And tears are a very, very normal way of an expression. Like, it's a very normal way of expressing my sadness. Just a bit like when you're sad, you cry as well, and Mommy will as well. And I think I'll be okay if I just sit by myself, I just allow myself to feel sad for a while. I think I'll feel a little bit better later. Or, Mommy just need to have a bit of green tea, or Mommy just need to have some chocolates, I just need to take a bit of time to myself. So narrating it helps them make sense of what I'm feeling. And if they demonstrate those healthy behaviors, I'm also always an advocate of positive reinforcement more than negative reinforcement. So if I take a bit of like my child's eating wars as an example, my child has this habit where he's just going to sit there for 1.5 hours to finish his dinner. And I feel like I age exponentially just watching him eat, just chewing, daydreaming. And we don't even have screens, just chewing, daydreaming, talking, taking his time. And that's really like a huge trigger moment for me where I can find myself like bubbling up inside. In that moment, when he eats quickly, right, I will positively reinforce that behavior through either like telling him, look, oh, wow, I really like it when you eat it, when you eat your food warm, I really like that we're going to spend all this time doing fun things when you finish your food quickly. So I positively reinforce that behavior. Or like another example would be like, if he's upset with his brother for snatching his toy and he didn't like lash out and hit the brother, I will positively reinforce that. I'm so proud of you for walking away when you were angry. So you're helping him identify the emotion and you are positively reinforcing that he's doing something healthy. Okay. I always try to remind myself that actually at the end of the day, what kind of relationship do I want to have with my child? Because the truth of the matter is we as parents have very little control over our children. Think of like, for moms, there was a moment where they're just living inside you and they have no say as to where you want to go because they're just inside you and they have to follow everywhere you go. And then they were a little baby and they still had to follow wherever you go. And then as they grow older, they start to have their own friends, they start to have their own minds. And those who have teenagers will know that your teenager is not going to listen to you. And your sphere of influence just keeps getting smaller as your child gets older. And, sometimes even when we hit adulthood, we will really just take what our parents say as like suggestions or advice, but we may not necessarily hit the advice. So at the end of the day, if I don't actually work on having a strong foundation, again, think about your house. If you don't scrape your house evenly and there are bumps in the ground, you must expect to fall. If you don't lay your tiles properly and there are cracks or, there's pipes coming up from below, you are going to fall. And I always try to remind myself that it's the relationship that matters at the end of the day. If I can build consistently a strong, secure relationship where my child feels safe with me, then I have a better shot at influencing his behaviors, his values, and his thoughts when he becomes a teenager. but check back with me again when he's a teenager, and then we'll see how he goes. So really building healthy relationships begins with being in the moment with them. So taking yourself away from the screen and spending quality time with them. You know, if you are sitting next to them and you have the phone, like you're replying emails or you are, you know, having to text your colleagues and work, then you are not actually really spending quality time with them. I would rather much, if for myself, spend 30 minutes of uninterrupted time with them in the day, than to actually be with them the whole day, but be on my phone or on the TV. And I will always try to have a respectful relationship with them, where I also try to speak to them like the way that I would like them to speak to me. Okay, so for those of you who have registered with the AKIDS Symposium who are coming into the clinic tomorrow, and you're going to get a goodie bag, we actually have a copy of this feelings wheel for you in a goodie bag. I think we have a lot of other things like books from Kinokuniya and NLB, and we've got some healthy broccoli snacks to try to entice your children to eat broccoli and some milk powder and stuff. But this feelings wheel is something that I thought could be helpful. I use this with my children, and I try, and earlier I was talking about the different zones. So red zone is the angry zone. So you think about traffic light, right? Green, amber, red, and then we've got blue, which is not traffic light. But green means good to go, you know, like go. When you are happy, when you are calm, you know, you are content, you go, you know, you can do things. When you are in the amber mode, you know, the amber color, yellow color, which means when you're feeling really silly, means like, you know, there's too much energy happening, or you're feeling really frustrated or nervous, then it's a, hey, you know, hang on, you know, wait. And then if it's a red zone, which is like angry and you are, you know, terrified or you are hysterical, it's stop. And then the blue zone is when they get overly tired or they feel very lonely or they feel sad, then that's also like a wait. So our children don't really know how to identify their feelings because it's quite intangible. But if you start to help them relate, like moment to moment examples, and you help them relate their physical symptoms, then they get a bit better at identifying their feelings. So now that's how I will speak with them. I'm in the green zone, let's go. You know, I'm in the red zone, I need to breathe. Children, again, little children, they don't actually really know how to breathe. So what I have tried to do is I've actually printed a birthday cake. So I have a laminated birthday cake on my wall at home, and there are a few candles on it. And then they don't know how to breathe, right? So I'll get them to, you know, when you're really angry and you're in a red zone, go and blow the candles. So they'll go to the wall and then they'll go to the candles and go. So you are giving them an opportunity to learn how to breathe. Because if you tell them breathe in and out, depending on the age, I find that sometimes that can be a bit of a struggle. Yeah. So that's a bit of like what I mentioned earlier, you know, the traffic light, you know, rest, go, wait, stop. And then on the right, I also teach them like a thermometer, which is a bit like an intensity of feelings. So, you know, again, modeling the traffic light, you know, the green is the, you're calm and everything, but if you're like intense level 10, then you really have to stop. So it's helping them identify that I'm a bit annoyed with my sibling versus I'm really, really, really angry. So, you know, earlier we were talking about like constructing the house. These are the tools that we will need, right? And if we actually communicate these to them prior to a tantrum, and we give them the tools to express their emotions and identify their emotions and be able to tell you that, Mommy, I am angry and like feeling like I'm a number 9, then that gives me a little bit more kind of opportunities to work with them to say, okay, go to the wall now. So now my children will be like, I'm angry, I need to blow candles. So they'll go out and blow candles and then they'll come back and I'm like, okay, are you still angry? Yes, I'm still angry. Okay, go blow some more, blow until you're not angry. Another thing that I like to use is water. Water is magic. Okay, any kind of water is magic. Drinking water is magic. Water play, shower, swimming pool, safely in the sea, beach. Water is magic. When your child is having a temper tantrum, and after you've sat through with them and all that, or if you find them escalating towards that, I often find that, offering them water, and a coping strategy that I tell them is also to drink water, or asking if they would like to take a shower and we can, play in the shower, helps them calm down. Water is magic. All right, I think I've come to the end of my sharing. I hope that was helpful. I will take all questions if I can find them. Celine, you want to help me out here?
Yep. I'm right here. Like, we have a question from the audience. This person says, my daughter is only 3.5 years old, but already the child will already bite the father when she throws tantrums. So the question is, how can I get her to stop? Further details are that she doesn't bite anyone else, but they are concerned that one day she might not be able to control it and might end up biting classmates or teachers.
Yeah. So biting is actually a very, so earlier, how I was saying, like the screaming, the shouting, the pinching, biting is also a very common expression of frustration, and it's actually a very primitive way of keeping ourselves safe. When we bite someone, that person usually retreats, or if that person attacks you, then, but basically biting is a way that we're trying to keep ourselves safe. Biting is also actually a way that children, when they haven't learned how to manage their frustration, expresses their frustration. The other thing that I should have also shared is that children tend to be able to have massive temper tantrums with their parents more than they would really likely be able to do that in school or in outside situations. That is a good thing because your child feels safest with you. And that's why the expression of tantrums is the loudest. So when you feel like a bad parent or you think you're a bad parent, remind yourself that it's because your child feels the safest with you. That's why your child is acting this way. But when somebody gets hurt, whether it's a parent or a sibling, the first thing is to remove them from the situation. So I will stop your child from biting father. So I will physically remove them. I will not reprimand the child, but I will, in front of the child, check on the father, on your spouse, and ask, are you okay? Are you hurt? Right? Because we want to help the child understand that when you bite, it hurts someone, and that's not right. Then I will hold my child, and I will, depending on what the situation is, I will ask my child, like, what's happening? What's happening for you? If your child is crying, then I will just allow the child to cry. But if the child is not crying and is still verbal, then I will ask what's happening with you. And the same thing with connecting with the child. I can see that you are frustrated because, this, you would like, whatever had happened with your father, but you didn't get it, and feeling frustrated or feeling angry is normal and it's okay, but biting is not. So try to use less words, but basically the message is feeling angry is okay, but biting is not. Or if it's a sibling, or you can be a bit more firm as well. Feeling angry is okay, but I will not let you bite daddy. I will not let you bite your sibling. Yeah, so that is what I would do.
All right, we have a couple more questions. Thank you everyone for typing in your questions. The next question is that I have read that you can actually prevent meltdowns or tantrums. Might be similar to positive reinforcement when a child is doing the right behavior, but this person has tried and it doesn't seem to work. So maybe Dr. Annabelle, could we get your views about this and how to prevent it?
Sorry, I don't think we can prevent tantrums. so we can, because your child is still learning, you see, your child is still learning to understand his feelings, her feelings, trying to still learn how to express the feelings and how to cope with the feelings, how to make sense of the feelings. Truth of the matter is, a lot of times, even us adults can't do it very elegantly, isn't it? It's just that our temper tantrums might come up in a different form compared to what a child might. It's less likely that we might be failing our arms and like kicking or punching someone, as an adult, but our temper tantrums can come out in a different form. So I don't think that we can necessarily avoid that, but through, building that relationship with them so that you allow them that safety and that secure relationship to come and talk to you about it, and for you to model the behavior, and for you to give them skills to help them identify their feelings. And in fact, actually tomorrow I'm sharing a talk on IQ versus EQ. So I will actually have quite a lot of information on the emotional well-being part. If you have time, you might want to tune into that. I think I'm speaking at 12 o'clock? 12 o'clock? Yeah. So I will actually cover a little bit more on that part. But the short answer is I don't think that you can actually prevent a tantrum. Yeah.
All right, thank you. The next question, Olive is asking, she says, I will be going on a work trip for a week. So how can I let my 2-year-old cope with my absence, as this is the first time that I am away?
Olive, you and I both. I have not left my kids, but I am going to be faced with this challenge sometime in the near future. I don't know. I think it's actually managing our own anxiety first and how we feel. It's not different from dropping our children in school when they first start going to school. And if we are anxious and we cannot let them go because they're screaming and crying, they will actually be able to read that, and it will make the separation harder. So I think it's still really like managing how we feel about it, and managing our own anxiety, and also just kind of making sure that all the support systems are in place. I think that there are some things that you can consider doing externally with your child, where you can actually have a massive calendar at home for the month that you are going away. And then you can draw 2 big circles of when you are leaving and when you are coming back. And you can get someone at home to do the crossing out with them, like, this day, this day, this day. And then, you count the number of days before you come back. And you want to try to kind of keep some things consistent. So maybe calling them at a consistent hour and time every night. So whether it is just before their bedtime routine where they are reading books, or when they are sitting down to have dinner, you might want to keep a bit of that consistency, or even in the morning, calling home when they're having breakfast, so they have something to look forward to, and they have something to, like they know that you are still there, even though you're not physically there. Something that I will be doing with my kids, something that I did with them for school, didn't stop them from melting down, but I believe that it did help to a certain extent to help them manage how they feel, was that with the school separation anxiety, I will draw like little hearts on their hand, and then I'll draw the little hearts on my hand, and I'll tell them that, look, mommy is there with you, just like how you are here with me, and I will be bringing you with me, when I go to work, and you bring me with you when you go to school. And I will try that when I go on the work trip as well, that I will do this. Of course, this little thing will wash away because it's longer than a day, but you can kind of think about like another format of that to help your child cope. Tell me how you go.
Yes, I think it would be very interesting to see what happens.
I might be crying to my colleagues. Oh no, what's happening? Yeah, so manage our own feelings first. Yeah.
Okay, we have another question. Are there any non-verbal strategies for a speech-delayed toddler who is still unable to understand what the parent might be trying to tell him?
I think this might be a more appropriate question for our speech therapist, Charmaine, because I think it's also having to assess a little bit more if the speech delay is a manifestation of something else. My child had speech delay. When he was 18 months, the pediatrician got really concerned about him and was very judgmental that I was not concerned at that point. Basically, you know, at that moment, I did have those challenges as well. And it was really more the physical presence. Even though they cannot express, they cannot say, they cannot speak, I think you also want to, like, a few things that come to my mind is you want to assess if they can understand. So at least for my child, he was able to understand, and he exhibited the understanding through pointing and through other ways of expressing himself. So if he can understand, right, then it's using simple words and being mindful of your tone and your facial expression when you are communicating with him. But otherwise, it's a lot of cuddles, it's a lot of holding him, and just being a little bit more mindful of like how you are talking to him. Yeah. But I would, depending on what age your toddler is, I would actually recommend for a speech assessment. Yeah, because you want to just find out if there's other things that is happening that you may not know. Yeah.
All right. I think we have time for one last question. All right, let's see. So Catherine is asking, my 2-year-old is currently enjoying school so much. However, we have decided to change schools for him next year. We told him that he will be going to a new school, and he seems okay, but we're not too sure if he really understands at this age. So how do we prepare him for this change?
We were also caught in a similar situation. I love parenting seminars because all these questions are like, yeah, I face the same thing. I think the first thing is making sure, very importantly, that everything else in his life stays constant. So you don't want to be changing too many things at the same time, especially for a 2-year-old. So you want to, like, I know sometimes it coincides with moving houses. Then moving houses means it's a new environment, it's a new room. You know, that is quite difficult and stressful, and it's difficult for the child to make sense of. And then at the same time, he loses his familiar school environment and friends, and having to adjust to both of them at the same time. So the first thing is I would actually recommend for you to consider, if it is a result of moving home, you might want to try to keep the school stable until your child has settled down in the home environment before you make the shift. So keep everything else constant. You can also read books about, there are books about like school transitions, changing school, having new friends. So you can read about that, or you can play, you can play out the scenarios with them, like through like free play with them, with your child. I think it's also helping him, like you can bring him to the new school. So whether it is like just walking to the school together or going to the compound and getting him to have a feel of it, letting him know that, hey, you're going to be playing at this playground, how do you feel about school? And at 2 years old, they should be able to tell you, say, I like or I don't like. So, I like or I don't like. Then it gives you a sense of like how much more you need to do or whether he's prepared. Again, I think children are generally quite adaptable, and it's really really more managing our own feelings and also helping them cope with the change.
Okay, thank you so much, Dr. Annabelle, for sharing all your insights and tips with us today. It was a very engaging presentation, and we hope that everyone was able to take something away from that. Apologies that we were not able to get to all the questions, but if you have any other queries, you are more than welcome to join us at our symposium day tomorrow, where it will be held in Thomson, and Dr. Annabelle will be there to chat with all of you.
Yes, come. And then we can have all the conversations about our parenting struggles. Yeah.
As you can see, she's very excited. All right, okay. Our next speaker will be coming right up in about 2 to 3 minutes. So we'll just do a quick little swap over and we will get going.
Okay. Thank you. Bye-bye.